All right, so you know why you're here, right? You're tuning into the deep dive because you want to cut through all the fluff and get right to the good stuff, especially when it comes to health.
Exactly. And today we're going to do a deep dive into heart valve disorders.
Yeah, we found some really interesting material on this topic, and we really want to break it down for you guys.
We're going to look at what these conditions actually are,
hmm
what causes them, the different types you might encounter.
It's all about understanding your heart better and how these valves play such a crucial role in your overall well-being.
That's our goal today, to give you a really clear and concise overview of this whole topic.
Yeah, arm you with the knowledge you need to understand how this incredibly important organ works and what happens when things go wrong.
Absolutely.
So, one of the first things that comes up when you start reading about heart valve disorders is this idea of heart murmurs.
Yeah.
I think most people have probably heard a doctor mention them at some point, but what exactly is a heart murmur telling us?
So a heart murmur is basically just a sound that your doctor can hear with a stethoscope. And it's caused by blood flow that's not moving smoothly through the heart or through the vessels connected to it.
So it's like turbulence?
Exactly. It's like
Okay.
turbulence. It's not a nice, smooth flow.
Wow. Okay.
And that can be a sign that there's either a structural issue or a functional problem with the heart, often involving the valves.
Okay, so the heart's talking to us through these murmurs.
Yes.
And in the material we have, it breaks down these murmurs into two main types, which I thought was really helpful.
Yeah.
There are the ones they call physiological murmurs, or sometimes you'll hear them called innocent or functional murmurs. What's the deal with those?
So physiological murmurs are actually pretty common, and they're usually nothing to worry about.
Okay, good.
They basically happen when blood flows a little bit faster than usual through a perfectly healthy heart.
So like when you're exercising.
Yeah, exercising, or, if you're anxious or stressed,
Right.
if you have a fever, anemia, an overactive thyroid, or even pregnancy.
Pregnancy interests me.
Yeah, so basically anything that makes your heart pump more blood can cause a physiological murmur.
Got it.
And these murmurs tend to be a little bit softer,
Okay.
more intermittent. They come and go, and they're localized to a specific area.
So they're not like this booming sound.
No, not at all.
Okay.
And they're not usually accompanied by any other symptoms.
So that's the good kind of murmur where the doctor's like, you're fine.
Exactly. Yeah. Nothing to worry about.
All right, but then there's the other category, which is called pathological murmurs, and those sound a little more serious.
Yes, those are definitely more concerning.
Okay.
Pathological murmurs suggest that there's actually something wrong with the structure of the heart or the way it's functioning.
Like what?
So it could be a valve that's not formed correctly, a valve that's not opening or closing the way it should,
Oh, wow.
or even a defect in one of the heart walls.
Okay, so those are red flags.
Yes, those are definitely red flags. And they often warrant further investigation and maybe some medical attention.
So two types of murmurs, two very different messages. Now, one thing I found really interesting in the material was the link between strep throat and heart valve issues.
Yeah, that's a really important connection.
How does an infection in your throat end up affecting your heart?
So it all comes down to something called rheumatic fever,
Huh.
or RF for short.
Or
RF.
Right.
Yeah.
Okay.
And if you have untreated strep throat, which is caused by a bacterium called Streptococcus pyogenes.
Streptococcus pyogenes, that's a mouthful,
It is a mouthful.
but it can lead to RF.
In a small percentage of people, yes.
Okay.
And RF is basically an inflammatory response that can affect different parts of the body.
Like your joints.
Yes, like your joints, your skin, your brain, and unfortunately your heart.
And the heart valves in particular.
Exactly.
So this inflammation from RF can actually damage the heart valve.
Yes, that's right. And that damage can be permanent, leading to a condition called rheumatic heart disease, or RHD.
RAG.
Yes, and what's interesting is that the initial strep infection and the rheumatic fever might happen in childhood, but the symptoms of RHD, like a heart murmur, might not show up until years later.
Oh, wow. So you could have had strep throat as a kid, and then decades later, suddenly you have a heart murmur.
Exactly. It can be a delayed reaction.
That's pretty scary.
It is. But the good news is that with the widespread use of antibiotics these days, RF and RHD are much less common than they used to be.
That's a relief.
Yes, antibiotics have made a huge difference.
So we've talked about heart murmurs and this connection to strep throat.
Mm-hmm.
Well, let's actually look at the specific heart valves themselves and the different disorders that can affect them.
Sounds good.
The material starts with the mitral valve.
Okay.
So where is that located in the heart, and what does it do?
So the mitral valve is located between the left atrium, which is one of the upper chambers of the heart, and the left ventricle, which is one of the lower chambers.
Okay.
And its job is to make sure that blood flows in one direction only from the left atrium to the left ventricle.
So it's like a one-way door.
Exactly. It's a one-way door.
Sure.
And it prevents blood from flowing backwards when the left ventricle contracts to pump blood out to the rest of the body.
Got it. And there are a few key disorders that can affect this mitral valve,
Right.
starting with mitral stenosis.
Mhm.
What's going on in that condition?
So in mitral stenosis, the mitral valve opening becomes narrowed.
Narrowed how?
So the valve leaflets, which are the flaps that open and close, they become thickened and stiff,
Okay.
often due to fibrosis, which is basically the formation of scar tissue.
It's like the valve is getting tougher.
Yeah, tougher and less flexible.
Yeah.
And over time, it can even become calcified, meaning that calcium deposits build up on it.
Oh, wow.
So this stiff, narrowed valve makes it really hard for blood to pass from the left atrium to the left ventricle.
And this is the most common type of heart valve disorder.
That's right. Mitral stenosis is the most common one.
Interesting. Okay, now what about mitral insufficiency? What's that all about?
So mitral insufficiency is also called mitral regurgitation.
Okay, two names for the same thing.
Yeah, basically two names for the same thing. And it happens when the mitral valve doesn't close completely or effectively.
So it's leaky.
Exactly, it's
I
leaky.
see.
So when the left ventricle contracts to pump blood forward, some of that blood leaks back into the left atrium.
Oh, so it's like backflow.
Exactly, backflow.
And what causes that?
A couple of common causes are a myocardial infarction or a heart attack,
Okay.
where damage to the heart muscle can affect the valve. And then there's also myxomatous degeneration of the mitral valves.
Myxomatous degeneration. That's a mouthful.
It is a mouthful.
What does that even mean?
So basically, it's a condition where the valve leaflets become really floppy.
Floppy.
Yeah, floppy, like loose pieces of fabric.
Okay.
And they can't form a tight seal when the valve is supposed to close because they're so loose and floppy.
Got it. So it's like a structural problem with the valve itself.
Exactly.
And the material also mentions mitral valve prolapse, or MVP,
Right.
and says that it's often associated with this myxomatous degeneration.
Yeah, so in mitral valve prolapse, one or both of the valve leaflets bulge back into the left atrium when the heart contracts.
Oh.
And this can cause the valve to leak.
I see. So MVP is kind of like a specific type of mitral insufficiency.
Yes, you could say that.
Okay, and sometimes you hear this called Barlow syndrome.
That's right.
Okay, so with the mitral valve, we're mainly talking about it being too narrow or leaky.
Exactly.
Now let's move on to the aortic valve.
Right.
Where's that one and what's its job?
So the aortic valve is located between the left ventricle, which is the heart's main pumping chamber, and the aorta, which is the large artery that carries oxygen-rich blood from the heart to the rest of the body.
Okay.
And the aortic valve's job is to allow blood to be ejected from the left ventricle into the aorta when the heart contracts, and then to prevent any blood from flowing back into the left ventricle once it's been pumped out.
So it's like a gatekeeper.
Yes, exactly, a gatekeeper.
All right. And what are the main disorders that can affect the aortic valve?
So the main two are aortic stenosis and aortic insufficiency.
Stenosis and insufficiency. I'm sensing a pattern here.
Yes, those are the two main categories of valve disorders.
Okay, tell me about aortic stenosis.
So in aortic stenosis, the aortic valve opening is narrowed.
Okay, so similar to mitral stenosis.
Very similar.
Okay.
And this narrowing creates an obstruction to the flow of blood from the left ventricle into the aorta.
So the heart has to work harder to pump blood?
Exactly. It's like trying to force water through a hose that's been partially pinched off.
Oh, wow.
It takes a lot more effort.
And what about aortic insufficiency?
So aortic insufficiency is also called aortic regurgitation.
Okay, another two names for the same thing.
Right. And in this case, the aortic valve doesn't close properly.
So it's leaky?
Yes, leaky.
Okay.
And that means that after the left ventricle pumps blood into the aorta, some of that blood leaks back into the left ventricle.
So again, backflow.
Exactly.
Okay, so we've got stenosis and insufficiency with both the mitral and aortic valves.
Right.
The last set of valves we need to talk about are the tricuspid valves. Where are those, and are their disorders as common as the others?
So the tricuspid valve is located between the right atrium and the right ventricle.
Okay.
And it controls the flow of blood from the upper right chamber to the lower right chamber.
Got it. And are these disorders common?
Actually, disorders of the tricuspid valve are the least common of all the heart valve disorders.
Oh, that's good to know.
Yeah.
But still important to understand. So tell me about tricuspid stenosis.
So in tricuspid stenosis, the tricuspid valve opening is narrowed, just like in mitral stenosis and aortic stenosis.
Okay.
And this narrowing makes it harder for blood to flow from the right atrium to the right ventricle.
And what does that lead to?
So it can lead to a buildup of pressure in the right atrium, and then that pressure can back up into the veins.
So it's all connected.
Yes, everything is connected.
Okay. And what about tricuspid insufficiency?
So in tricuspid insufficiency, the tricuspid valve doesn't close properly, and that allows blood to leak back from the right ventricle into the right atrium.
Okay, so again, we're seeing that theme of leakage. So to recap, we've talked about how heart murmurs can be a sign of a problem with the heart valves. We've explored the link between strep throat and heart valve damage, and we've looked at the different types of disorders that can affect the mitral aortic and tricuspid valves.
Yes, that's a great summary.
So listeners, why should you care about all of this?
Well, understanding how your heart works and what can go wrong with it
Yeah.
is essential for your overall health.
Yeah, it's empowering to have this knowledge so you can be more proactive about your health.
Exactly. And you can have more informed conversations with your doctor.
Now, this deep dive raises an interesting question.
What's that?
We've talked about infections and structural problems with the valves themselves, but what other factors might influence the health of our heart valves?
That's a great question.
Yeah, I mean, our lifestyle choices, our diet, our stress levels,
Right.
other medical conditions we might have, even our genes,
Right.
all of these things could potentially play a role.
Absolutely. It's all interconnected.
So food for thought, listeners.
Definitely something to think about.
Thanks for joining us on this deep dive into heart valve disorders.
Thanks, everyone.
We'll see you next time.
See you later.